I recently hosted a conference called IFAS. To briefly explain what IFAS is, it's a gathering where doctors from various countries come together, give lectures about surgical techniques and perform surgeries, sometimes even demonstrating the procedures in person. Today I'll be reviewing before and after photos of a lady in her 20s who underwent surgery at IFAS and sharing my thoughts on the results. She's in her 20s with a slim build, a chest circumference of 70 centimeters, height of 162 centimeters, and weight of 50 kilos. She had a slender body type, her breasts were slightly apart, with a wide distance between the nipples. There was hardly any difference in volume between the both sides. If I had to point out any asymmetry, the left inframammary fold was slightly higher. The patient wanted a full C-cup size. She exercises a lot and is quite active, so she preferred an inframammary incision. From the side, her upper chest appeared to lack volume, and because there wasn't much volume, the inframammary fold wasn't very pronounced. The surgery was performed using the dual plane technique through an inframammary incision. We used Mentor Boost implants for the procedure. Moderate high 355cc implants were inserted on both sides, the same size. Since the patient wanted to enhance the upper breast volume, we chose Mentor Boost implants, which have better gel elasticity and can fill out the upper volume more effectively. That's why we use Mentor Boost implants. This is a photo taken 1 month after the surgery. We slightly lowered the left inframammary fold to match the right side, so that both are positioned on the same horizontal line. Since the patient's nipples are set a bit far apart, we also did quite a bit of dissection on the cleavage side. However, if you try to create more cleavage and dissect too much toward the inside, the two breasts can actually end up sticking together. So usually there's a bone here called the sternum, and the pectoralis major muscle is attached like this. We typically dissect up to just before the junction between the sternum and the pectoralis major, making sure not to sever the connecting area here. For patients who are very physically active, naturally, these patients tend to want a quicker recovery themselves, so they usually prefer the inframammary fold incision a bit more. But it's not impossible to use the armpit incision either. Both the inframammary folds and the upper chest are well aligned. She wanted the upper chest area to be firm and full. It seems that the Mentor Boost implant has fulfilled that desire well. It's only been a month since the surgery, so the cleavage can still feel a bit tight and firm at this stage. But over the next 2 to 3 months, as the skin and tissue stretch, you can expect the cleavage to become a bit closer than it is now. Also, sometimes after surgery, patients experience pain in the nipple area. There are some people who complain about this. When an implant is inserted, the outer skin usually becomes a bit numb, while the nipple area actually becomes more sensitive, so even a slight touch can cause a tingling sensation. But as time goes by, this is a process that gradually improves. And the patient wanted a full C-cup. After the surgery, she actually preferred the swelling at exactly 1 week post-op. So she said she hoped it wouldn't go down any further. That's what she said. But at 1 week, there's still a bit of upper swelling left. As time passes, it does go down a bit more. But the patient herself wasn't the type to have a lot of swelling. So it won't get much smaller than it is now. This is a case where both the upper chest and the lower curve turned out very well. Today I explained a breast surgery case of a lady in her 20s. I'll be back next time with another case. Thank you.